Hi everybody, welcome to Beauty Buzz with Lori. Today we are going to be talking about acne and acne scars, treatments that you can do for these things. So acne is a very common problem. Most people have experienced it at some point during their lives. If you haven't yet, you probably will from a hormonal standpoint as an older person as well, because we're constantly having those hormonal changes, and our body basically manifests acne whenever it goes through these things sometimes. Basically, when you come into the office for a consultation, because anytime we're addressing something like this, I need a lot of information from you. So some of the things that I'm going to be talking to you about are going to be, what is your lifestyle? What are your overall healthy habits or non-healthy habits that could be contributing to the production of acne? Basically, overall, I want to know what your concerns are. And so with all of this information, I am better able to put together a treatment plan, a skincare plan, try and stay within your budget, whatever that may be. Most of my patients that come to me are very serious about, getting rid of their acne. They've been going through it. They've had no success with the things they've done in the past, and so I consider it a very high honor to be able to help you through this process. It's really difficult to pin down specific things without knowing specific concerns, so I'm just going to go through what might happen if you come in the office, dependent upon your specific circumstances. So first of all, I try to address the oil production. Oil creates inflammation. Our body produces natural oils, and yes, we do need those things. It's whenever it goes into an overproduction. When we're producing too much oil, that's when we get that inflammation, that clogged pore. For some people, that is exacerbated by how they eat, what their lifestyle is. And so I try to address all of those things. So gut health is also a big thing for me to address whenever you are in your consultation. With that said, I always note I'm not a doctor, I'm not a nutritionist, but I have been a skincare specialist for 16 years, and I've witnessed a lot of different scenarios. And I just want to try to figure out with you what the best route is going to be. So this is part of that process. One of the other things is that treatment-wise, a lot of times we need to do not just product for the consistency of home skincare, but also treatments that will help to further your process and get you the results that you want to get. Let's just deal with acne to start off with. So skincare-wise, Zeo Skin Health has hands down the best oil control system that I've seen. So a lot of times getting your oil under control is going to look like a good cleanser, a scrub that has salicylic acid in it, and also oil control pads. So it might be either, depending upon your skin, gentle cleanser or the exfoliating cleanser, and most likely dual action scrub as well as oil control pads. So I was taught early on with Zeo Skin Health that the oil control pads, you're not married to them. It's a 30-day process. If we need to do another 30-day round, we can do that. But just to get that oil under control is so important. The reason I say that is the oil control pads are pretty strong, and so sometimes they can yield some dryness or redness, but rest assured they really do work. And then once we get that oil control underway, then we can move you into complexion renewal pads or calming toner, whichever one is more specific to your need. So after we get the oil under control, we're going to move into treatments if that's something that is needed for you. So if you have active acne, usually getting the oil under control is going to reduce that significantly. So we do that with product. A treatment might be a hydrofacial. So I do a clarifying acne hydrofacial. A lot of times you just need extractions, and good extractions. So the hydrofacial provides that with the suction that it does, but also I always, when I'm doing a clarifying hydrofacial, I always book at least a half an hour extra above the hydrofacial, because that gives me time to go in and do some manual extractions if needed. So depending upon whether you already have some acne scarring, we might do a treatment program like peels, pins, and PRF. Peels is self-explanatory. I would choose a specific chemical peel in order to address your concerns and whatever's happening with the skin at the time to help that acne heal and get dried up. And then we would schedule you 4 weeks from that, and you would come in for a microneedling treatment with PRF. So what does that look like for you? A microneedling treatment with PRF is going to be where you come in, I prep the skin, we numb you topically for the microneedling so it's a comfortable treatment. Our nurse practitioner Becky would come in and draw some blood from you. She's going to spin that down in the centrifuge, and then she's going to pull the platelet-rich fibrin off of it. So we like to use the platelet-rich fibrin as opposed to the platelet-rich plasma because it is more rich in growth factors, and so you have that accelerated healing process and also that collagen stimulation. We have seen types of scarring that this is not going to work on. Again, that would be part of your consultation, that we would make that assessment and move on from there. If you don't want to do any treatments but you still want to yield some really good results with acne, then tretinoin is another option. So typically when I'm doing tretinoin, I like to provide a buffer. So I use a hyaluronic serum, which is Hyalus Plus by Neocutis, and also a recovery cream, which is BioCream by Neocutis. And so these three products mixed together makes doing the prescription tretinoin at either, I don't typically bother with the 0.25%, I just jump straight into the 0.5% or the 1%, depending upon if you've ever used anything like that before. But the 0.5% you still yield really good results with. So I've had great success with that too. If you've got a situation where you just don't have the money to throw at treatments, but you still want good results, then this is an option for you. My last option is always to send you to the dermatologist for Accutane. So if we have tried all of these things, then that is our last option. You're going to have to see the dermatologist, and then they can take over from there to monitor you on the Accutane to help get that all cleared up. This typically is whenever you're getting that really painful cystic acne, and I don't just mean 1 or 2 spots. It has to be, you know, it's like a face full, or some people get it around what we refer to as the collar, which would be around the chest and the back, the upper back. This is really uncomfortable and painful to go through, so it's important that you're monitored by your doctor through this process. So these are just a few of the things. Again, this is such a broad subject. It's something that you really want to come in and have a consultation so we can cater specifically to your skincare needs. Call today and book an appointment if you're experiencing acne and/or acne scarring, and we can get some help for you. Thank you for watching.